My name is Mike Cooper, Parish President for St. Tammany Parish, and I'm happy to welcome all of you here this morning, here at the Justice Center in downtown Covington. I'm joined today by Sheriff Randy Smith, Dr. Charles Preston, Parish Coroner, St. Tammany Parish Fire District Number 1 Chief Chris Kaufmann, Richard Kramer, Executive Director of the Florida Parish's Human Services Authority, and Dan Schneider, advocate and subject of the Netflix docuseries, The Pharmacist. And also standing in support, St. Tammany Parish Judicial District Attorney Warren Montgomery and his staff, and members of the 22nd Judicial Court Specialty Courts, Judge Alan Zornbrecher and Judge Vinnie Lobello, representing our judges. We're here today to announce another tool in the fight against the opioid epidemic that is impacting our community, as it has impacted so many communities in the United States. The opioid epidemic is real, and it's crippling to the families who face it every single day. The Louisiana Department of Health reports that in 2019, St. Tammany Parish had the second highest number of opioid-involved deaths in the state of Louisiana. We're committed to fight against this dreaded addiction to drugs. With the hard work of my dedicated staff, Team Tanmany, we're proud to announce that starting today, NARCAN, an opioid antagonist, will be available at no charge to members of the public at select local fire departments and at the offices of the Florida Parish's Human Services Authority. A map with all locations is available on our website at stpgov.org/NARCAN. While NARCAN is not a solution to addiction, it does offer our citizens a second chance to save the life of their loved ones, to start them on a path to recovery through treatment. We're proud to facilitate this program and grateful to all involved stakeholders who will make this life-saving effort a reality. I'd like to call on first St. Tammany Parish Sheriff Randy Smith, who will give us an update from his department.
Thank you, Mr. President. This is another way to combat the opioid addiction crisis in our parish. And all our deputies, every single deputy is not only has NARCAN in their possession, but they're trained to administer it when needed. We have already saved lives, but it's not just saving lives that's important. It's getting the addicts the attention, the resources to get them help, not just put them in jail. We want to continue to work with the families and our partners that are represented here today to get individuals that are fighting these demons and those addictions that we're here talking about, to get them resources to get help. That's what's more important than anything. And this program is doing that. So we will continue to combat the war on this opioid addiction and to save lives and get people help. Thank you.
Thank you, Sheriff. Dr. Charles Preston.
Thank you, Mr. President, and I want to thank all of our partners here and the partners that aren't here that continue to fight in this battle against addiction. This is an important step forward to rip away the stigma that addiction is a moral failing and not, in fact, a medical disease, which it is. In St. Tammany Parish in 2019, we saw 93 overdose deaths. 72% of those had some sort of opiate on board. In 2020, that number shot to 126, which was 35% increase, and 87% of those fatal overdoses had some sort of opiate on board. And year to date, we're right on track with 31 overdoses, 25 of which involved opiates, which is roughly 80%. Probably the most concerning statistic of all is the percentage of fentanyl that we're seeing in these overdoses. And that percentage went from about 60% to 80%. NARCAN is a critical tool to save a life. Think of it as an EpiPen in an allergic reaction. That can save a life to give somebody the opportunity to get treatment for their underlying medical problem, which is addiction. Thank you.
Thank you, Dr. Preston. Chief Kaufmann, Fire District, District Number 1. Chief.
Thank you, Parish President Cooper. First of all, I want to say I'm representing the St. Tammany Fire Chiefs Association here in St. Tammany, and I'm so pleased to announce today that all of your fire departments here in St. Tammany have embraced this program. We want to be the distribution site for family members and friends to be able to find the location nearest them so that they can get NARCAN in the event of one of their family members or close friends overdoses. This is only a step, as you hear all of us say, in the right direction. But to have all of our agencies working together to give these people a chance at life, we know NARCAN is the beginning. And I want to take another moment just to talk about the families that this affects. For every one person that's an addict, it affects 12 people around them. We all know recovery is the answer. And the only way we're going to get people to the recovery programs is to give them the information, the data, give them the guidance, and point them in the right direction. And that today is this press conference where you see all of our agencies working together to provide a program in St. Tammany where we have identified we have an opioid problem. So I thank all of my partners here today behind me for embracing this. We're responding to these calls every day. And now I think we have another step allowing family members to maybe administer the NARCAN before we even get there, because time is life in our business. Thank you so much.
Thank you, Chief. And now Rich Kramer with the Florida Parishes Services Authority.
Thank you, President Cooper. I first want to commend President Cooper for taking this step to save lives of people in our community, and I want to thank him as the executive director of an agency whose mission is to serve people with opioid addiction problems. I want to thank him for inviting us to be a part of it. As you heard from Dr. Preston, obviously the opioid problem has been a problem here in our area for a while, and it's only been exacerbated by the effects of the pandemic. So, we can only expect that things will continue to be a struggle for a while, and this is an important life-saving initiative that can make a difference. I want to point out, make sure to say that recovery is available it is an option for people that are addicted to opioids, and the only way that can occur is if we can keep those people alive long enough to get them into treatment. So this life-saving effort can help us get them there, can help get them clean, and help to help them and their families. As was mentioned, the NARCAN will be available at all of our clinics. We've got 2 here in St. Tammany Parish, 1 in Slidell, 1 in Mandeville. You can find more info on how to reach those locations at our website at fphsa.org. And you can go to any one of those and get NARCAN, or you can reach out to us and call us at 985-543-4730, extension 1206, for more information. Thank you.
Thank you, Rich. And now Dan Schneider, the pharmacist.
Thank you, Mr. President. Again, most people have heard my story, but I lost my son 22 years ago in a drug-related incident. It put me on a mission. Some people call me a vigilante. I went after some doctors with the opioid prescriptions. And I've been battling many different ways to try to reduce and prevent tragedies such that happen to my family. And so this is an important thing, NARCAN. We have to, again, stigma is a big issue. And some people, not many, but still there's a few diehards that are saying, geez, these people, we got to continue to save them. Well, what if it was your kid? Anybody that has any doubt whatsoever, what if it was your kid? you'd be thankful to God that either you had a NARCAN to administer him and save him, or that the fire department would get there, or the police department would get there. This is a big deal, offering this free at all of our fire stations. We all need to pull together in this. It takes way more than this. I have a nonprofit myself called Tunnel of Hope, and I have a website. You can get information there. It's tunnelofhope.org. But you know, St. Tammany is doing a great job here on this, and again, this NARCAN thing is a lifesaver. Make sure you're aware of it. It's easy to figure out how to use it. If not, ask a firefighter, and God bless you guys.
Thank you, Dan. Thank you, Dan, and thank all of those who have shared their story and shared the importance of NARCAN and how it can be used to save lives here in St. Tammany Parish. Again, I want to recognize and acknowledge the offices of the District Attorney that are represented here today, and also Judge Zornbrecher and Judge Vinnie Lobello. Would you all like to say anything? Thank you for, again, being a part of this, these efforts. St. Tammany has been on the forefront of many efforts and many causes, and of course this is just one of the most important, that we all stand here together with our partners. To get a little bit more specific, we have 1,980 doses, or 1,980 packages with 2 doses that will be available to our citizens at the fire department locations and the locations of Florida Parish's Human Services Authority, as was mentioned earlier. This is brought to us through a grant from the Department of Justice. And I want to thank Michelle Harris with St. Tammany Parish government, who is very instrumental and very persistent in getting this grant and getting this from the Department of Justice. This is one of the largest grants of this type, and we're certainly grateful to have that provided to us here in St. Tammany Parish. So I'm going to turn it over to you all for questions, and you can pose questions to myself or any of the partners that you see standing here. And while I wait for the first question, I want to thank the media, print, radio, and TV media that's here with us today too to cover this story. So with that, I'll entertain any questions.
For the people who pick this up, is there any required training? Or do they have to get trained, or can they just get a box and go?
I believe there's a, it will come with a package with a code on it that will give instructions for that. You want to bring the bag up?
So the instructions come with it. It's not like there's nobody on hand to tell them how to do it.
That's correct. Instructions come with it. And NARCAN has been available to some of our local law enforcement agencies over the past few years, but this will, and it has known to save lives here in St. Tammany Parish. This will be more widely available so that during this particular time where there is stress, during these challenging times with the pandemic, now more than ever, this can be a life-saving for our citizens.
How did the connection with you and Dan occur?
If I can just also add to President Cooper, it's a nasal spray. It's very simple to do. It takes 2 to 3 minutes to get in your system, and what the drug does is put a block on the heroin. So it puts a block on that drug and reverses the effect. And it gives you about 2 or 3 minutes, it'll take effect. If you're not on the drug and by accident you give it, it has no effect to you. So there's nothing that you can really do that would hurt someone. This is truly giving people an opportunity to save a family member or friend.
But Chief, still, when they're revived and they can breathe again, they still need to get to the hospital right away.
Absolutely. Absolutely. Thank you for bringing that part up. This is just going to wake them up, so to speak, because they will either be unconscious and in some cases cardiac arrest. It will bring them back to life. And there is a window of time that we still need to get that person medical attention, get them transported to the hospital for further medical treatment.
Could somebody speak to the Good Samaritan law? Because there was a mention in the press release that even if you're using yourself or you're on drugs or you have drugs, you could call for a medical intervention and I guess you don't get arrested. Is that the idea?
That is true. That's some of the programs we've started, that if someone does call us for help, we want to be there to provide the help they're needed. Because when something goes wrong with an individual family member, they usually call 911 and the police arrive first. That's why, again, our deputies are trained not only to use it, but have it on board in their units to administer it. What else is important through crisis intervention, we want to follow up on the recovery process to make sure that individual has the resources available to him, her, or the family to get them into some types of substance abuse clinic to get them clean so they can be reacclimated with the society and get clean.
Talk to the sheriff and Dr. Preston. Last week we had the story about the counterfeit Xanax that's on the market here that's really fentanyl, pressed fentanyl pills. And the DEA confirmed that they're seeing a lot of that. Dr. Preston, you could talk about the medical side of what you're saying. And Sheriff, you could talk about going after the criminals who are selling this fentanyl, this counterfeit Xanax that's on the streets.
So that's probably one of the most important points that we can make, is there is no FDA for illicit drugs. And so when somebody is acquiring the drugs from a local supplier, there is no telling whether that's pure heroin, pure fentanyl, or a mix of it. And as I mentioned, what my office sees most frequently is polysubstance drug toxicity, in which an opiate is one of those, and increasingly fentanyl is in that drug mixture. So it may have been taken as a pill, they thought they were taking a Xanax or a Percocet, or they may have injected it thinking they were just injecting heroin when in fact they're injecting fentanyl, which is virtually a lethal injection. And another good point you made, Meg, is that people still need to be transported to the hospital because most opiates last longer than the NARCAN does. And so if they're not transported, they will become somnolent, stop breathing, and will require additional doses of NARCAN.
But on the autopsies, what percentage are you seeing increase that it's this fentanyl that people thought, these counterfeit?
It is up to around 80% of the overdoses now have fentanyl on board.
The sheriff, okay, go ahead, yeah.
I want to say something about that because this is really critical, okay? Fentanyl is a big problem, and there are a lot of addicts that have had issues for a long time, and they're getting this potent thing, and now it's killing them, okay? But we got a new dimension coming in now. We have 16-year-olds that go on social media, okay? We have novices that go to a party. These people, as of yet, don't have real substance use disorder, okay? And they're getting a simple Xanax or Percocet, and it's either pure fentanyl or laced with fentanyl, and they're dying. I got a campaign right now called Stop Fentanyl, and we're going to go to all the schools and get this message to parents and students. We might just save a life. These are young, innocent kids that, unfortunately, will do a little experimentation, okay? But that experimentation shouldn't end in death. So I'm glad you brought that up.
Yeah, just real quick. You know, we're not immune, any community in this country, from the sale of illegal narcotics that are killing our adults, our residents. We continue to combat the war on drugs. We're kicking in doors with information from individuals that suspect drug dealing in our communities, and we've seen an influx through our crime lab through analysis on some of these pills you're talking about that have fentanyl in it. So it is important, and somebody that's not an addict, like the pharmacist said, somebody that's been on it has a stronger immune system to accept the fentanyl, where somebody that hasn't had it in their system could cause immediate death from one one pill or one source of a fentanyl product. So it is dangerous, and this is what this is all about, to save lives in our community and get people help.
I guess my question is can they be prosecuted not only for the illegal drugs, but for the death of people?
Absolutely, yes. We've made several cases where we were able to track down who supplied the illegal drug that was issued to somebody that may have caused their life. We've worked several cases, not only with state police, but with our federal partners as well, to bring justice and closure to the families that lost a loved one here in St. Tammany. We'll continue to do that.
Y'all mentioned the quantity you have. Do you expect that to run out pretty quickly, and will there be any effort to sort of keep it on hand?
I would think that because of the nature and importance of NARCAN, that there will be a demand for this, particularly now that we're announcing it, and the availability at each and every fire station here in St. Tammany Parish. I do feel that there'll be a great demand for that. We'll just have to see what we can do to replenish this source once we run out. Sure, Rick.
I just wanted to mention there's several federal grants targeted at the opioid epidemic that agencies like mine, our safety net providers, have access to. So there's a possibility that we'll be able to continue supplying NARCAN beyond this as well, and we'll want to continue to work with the parish to be partners in making sure that that's available.
Only thing I'll add is all your fire departments and law enforcement agencies carry NARCAN. Our message today is help us help you if you're a family member or friend of someone that's an addict, because you never know who's going to be present when it happens, and time is life again in our business. So we have it when you call 911 with the response. It's what happens if that doesn't happen quick enough, or you don't know how long that person has been overdosed. So, help us help you. This is a step in the right direction. Come get a NARCAN pack for your family member, friend. We'll help you if you need any instructions to understand how to administer it. Any of your local fire departments will do that for you, and hopefully we'll get these people in our parish into a program.
Thanks. I believe with that, I want to thank, again, all of the partners here with us this morning that has made this endeavor possible. And finally, I want to thank my staff, particularly Amy Bouton, and all those in the Public Information Office and our Grants Department for making this opportunity available to our citizens. Thank you very much.